Hello and welcome to the Therapy Corner. At the Therapy Corner, what we try to do is enlighten, educate, and demystify all things psychological. And as you can see by my background, we're still in isolation, so to speak, and not in the studio. So today, though, we have a really special guest, as we always have special guests, but this time it's an unusually special guest. This is Richard Oldberger, PhD. He's a licensed clinical psychologist and a performance consultant. By the way, he also has a black belt in martial arts. He helps clients manage stress associated with elite performance, as well as leveraging the mental element of success. When not working with athletes and performers, he also hosts a podcast called Richard Listens. He has said, for as long as I can remember, sports has been a part of my most intimate relationships, memories, and creativity. So I welcome Richard onto our show, and he's going to be talking about the hero within.
Thank you so much, Ole. It's a real honor to be here, and pleasure to be with you, even though we can't be in person today. Although I have to say it's a little intimidating with Albert Einstein looking over your shoulder.
He's my favorite guy. He's got a lot of really good quotations about life in general.
See, this is the test how focused I can stay as well. Yes, and I have to guess who some of the other figures are, if they're Don Quixote or you have some other. But yes, I find so there's pressure to perform for me right here. But yes, I mean my goal is to whether it be athletes, coaches, parents. And in the modern day, high performance can be applied to so many professions because we know that the speed of the way in which we are working is becoming faster and faster, and the ways in which we're processing information is becoming more and more rapid. So helping individuals we all know that we can only hold so much information and in our memory, and we can only do so much without having an ability to release some of that stress if we want to be effective and continue on a path to greatness. So most often people are coming in, right? What is stress or anxiety is some level in which, from a somatic perspective, we're either stuck with kind of the on button on, we're not recharging our computers, our inner computers, or, when we get to a level of kind of burnout, depression, we've kind of, pulled the generator switch and we are kind of emotionally flatlining because it's just been too much for too long. So helping individuals to work through that process and learn how not to go to the extremes in order to cope and to maintain their level of performance, and also find some of the joy and satisfaction, ability to care for themselves, is part of the work that I'm setting out on.
Wow, that's sounds like a Herculean task, speaking of heroes. But it sort of brought to mind an old, when I was 19, 20 years old, I worked as a mechanic for a mechanic. And, it's like we tend to forget that we're not unlike engines in some respects. There's only so much stress and strain you can put on the engine before it starts to break down and falter. And they need to be tuned up from time to time. So sorry to use such a mechanistic view of it, but
that's beautiful and a great book. If you ever, someone I think gave to me early, right when I got to college, is Zen and the Art of Motorcycle Maintenance, and but it really is true. I oftentimes, whether it be the influence of Sigmund Freud and my family being from Vienna, Austria, at least part of it, the push towards the mind and the unconscious, and there's a movement away, at least it was in my education, away from what's happening to the body in the most simplest ways. What is your body communicating to you at different times? And whether through learning or just through habit, we kind of bypass those messages. And so, I'm sure there's plenty of books written on this condition for stress, and the antidote has started to come out, about, learning how to be mindful. I think one of the greatest gifts of the time period we've been in. I know we're not focusing too much on the quarantine today, but the gift of mindfulness, that if you are really still and can go to a place of quietness within yourself, to kind of have to create this separation between the speed of the demands around you and the stressors, no matter what your profession may be, whether it be a therapist who's taking on the challenges that other people face, or an athlete who has to respond to so many stimuli in a given moment.
Yeah, it's interesting. I never cease to amaze myself at something that Joseph Campbell once said about there are no new ideas, they're just rehashes. And when we start talking about mindfulness, I mean, my gosh, that's Buddhist teaching from way back. Good Lord, thousands of years old. But it's like, it's really important, I think, for us to look at some of these things. And as you say, our fast-paced society and our need to excel and achieve, we sometimes forget some of the little stepping stones along the way, like mindfulness, like really being present.
It's funny you said that. I promised I would share more stories, and I don't tell people this often, but, there was a day, I think I was in 10th, 11th grade, and I got into reading. I discovered Jack Kerouac, and during quarantine, I picked up Town and the City because it's one of those 400-page books, and I'm like, I'm going to finish it. But I was reading On the Road, which is a wonderful book about the journey through the California coast and getting in a car and journeying and all that. I mean, I'm reading the descript language of the smells and the sounds of the train, and it really, really awakens a lot of the senses. It's a real gift to read something like that, even for someone like myself who always wants to talk shop and read textbooks and things like that and get the next certification. So I'm really noticing how amazing that is for me to get into this language. But at one point, I was playing basketball. I always tie sports in. And my friends came over and they said, well, where are you going? I said, I have a meeting with the rabbi. And they said, well, what's so important that you had to make a 4:00 on the Thursday meeting with the rabbi? And I was not really connected at all religiously, but I wanted to go in and ask him about mindfulness and the Buddhist teachings that were coming up in the books. And I was like, well, how come they, the Buddhists have this practice, but what about the rest of us? And it was an interesting kind of debate. I don't think he was prepared for someone to come in and kind of challenge him, but basically the answer was, we all have access to this learning. This is something there. I just don't know that it was as present when I was, at that age, as being something that we all learned how to do. We learned about it. We talk about reflection. Certainly in I was raised in the, Jewish religion and culture growing up. There's times of pause. There's times away from work. But not to the extent that I've seen since, the last 15 years learning about Jon Kabat-Zinn, the impacts of really the types of thoughts we have and how that can affect our health and the relationship to illness. Mm-hmm. So when you look at an athlete who's certainly at that high level and is moving at that speed, and you start to look at what does a pitcher think to himself in between pitches, or in between games, and these are not things that we're seeing on the outside. So the relationship between ourselves to ourselves, how we speak to ourselves, how we talk to ourselves, how we treat ourselves becomes more and more significant. And the same could be said for therapists, right? If we're just seeing ourselves, if our whole view of ourselves is that we are there to hold pain and that we don't see ourselves worthy of the same care and love, it can be quite catastrophic.
It's amazing. You triggered about 4 different thoughts.
Cut me off every time, Ole.
But it was just amazing, because first off, the fast-paced society we lived in, and at the beginning of my semesters when I teach, one of the things I tell my students is how the attention span has dwindled down to now it's 8 seconds, which is 1 second less than a goldfish attention span. And it's because, and it was Microsoft did the study on this, and it's because we lived in this fast-paced, got to get it society, and there's just only so much we can do in such a short period of time without really overwhelming ourselves. And you talked about that, and that triggered the whole thing about, self-care. I mean, we talk a lot about it in our profession. I know we do, but getting the word out there to other people that y'all need to be paying attention to it as well,
Well, it's really hard because each person is so unique. And, the thing is, these responses are adaptive. On some level, on a societal level, the attention span shrinking must be what we need to survive in the modern society.
Exactly.
So there's so much information, there's so much input coming from a variety of sources. So the ability to move quickly, to be able to tackle many tasks at the same time or do many things at some level makes us more proficient in the modern. So, we want to validate that part of ourselves that wants to move quicker, faster, adapt. I think the thing when people, the self-care part of it is we don't know what toll that's taking on you as an individual and where it's impacting you. So if you're a physician and you're in a crisis and you're in a hospital, well, being there to serve and save lives is an amazing thing and keeps people alive, literally preserves our society and our evolution. On the other hand, if at one point you are so overwhelmed that your decision making or ability to be fully present with the person you're with gets impacted, that's harmful for you as the doctor. So finding ways to let go of all those stressors, finding ways to practice some form of muscle relaxation or imagery, right? Some way that you can let go of tension and just validate yourself for all that you're doing. There has to be, we call it like the expansion of the container. There has to be a coming up for air. Otherwise, the body starts to, hold on to that tension, and it can impact all kinds of both emotional, digestive, all the other nervous system interactions. And there's, it's a growing field now of trying to understand the relationship between, the mind body, relationship. That continues to be an expanding and growing field of health psychology.
It again triggered another memory. Many years ago, I'm also a registered nurse. When I was working as a nurse, I was working on a telemetry floor with a wonderful nurse. Bridget was one of those nurses where I said to her, actually, I said, if I ever get sick, I want you taking care of me. But one day we had a code. One of the patients had heart stop breathing. And we had a full code, doctors, everybody in there, crash cart, whole 9 yards. We're going at it tooth and nail. Weren't able to save the patient. As we're cleaning up, I suddenly noticed that Bridget was missing. I went down to the break room, and there she was, sobbing, crying. And I thought, this wasn't her patient. She wasn't connected to the patient in any way. But there was that need for the release. And I never got that at the time, because as a nurse, it's go, 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 do. She was smart enough to realize she needed to take that break and release.
Yes. And you touch on, many other things. I mean, first of all, right, that validation, that taking time, if you've had a tough case, that, the team approach, the tribe approach to healing, that if you need to take care of yourself, that it's understood and supported. The impact of, if you're in a healing organization or someone that treats trauma and health, having that kind of leadership is really, really significant. Secondly, the importance for me, a lot of my focus is on working with men, that has not been conditioned, that it's not okay. And some may be better than others. I'm not here to, but I was not taught with that permission, that it's okay to cry, that it's okay to have that release. So supporting boys, men to feel and to, express emotions in ways that are, not harmful to anyone else or to themselves, that it's so amazing and so beautiful, and to provide that trust that you can get met with support when you express. So, I mean, that's some of what we do in therapy, but if you can create that in your teams, especially in healing environments, if you can create that in a hospital or clinic environment, where if you go on a tough, at the county, I went on these crisis calls. If you see something stressful, or if an intern, somebody who's in training, who's maybe less prepared or less experienced, goes through something and is having an experience, that there needs to be a place where they can express it and feel held and safe. It's really about safety. It's really about emotional and psychological safety, because when we feel safe, we'll push ourselves. We do have a performance, right, to do more. And in the case of a nurse or doctor, I mean, going in to take on something when you've just seen something painful happen, Well, that's a very difficult way to perform.
Right. Yeah, brought to mind a client I had. He was a doctor, and he was in his late 40s, early 50s. It's been several years. But it was interesting. He carried around a memory from his internship that haunted him to this day until we started working on it, about a death that he just felt totally responsible for and couldn't get through. And it was a tragic thing, and he wasn't even involved directly in it. He had a supervisor who was involved in it, but he carried that, and it brings to mind, yeah, not only are physicians supposed to be the tough guys who hang in there and take care of everybody else, but by and large, a lot of them are men, and we are taught, you're right, we're all taught, big boys don't cry, dust yourself off, move on, don't get emotional, you're not a little girl.
Right. And the fear is, if I let myself process, if I let this emotion out, I won't be able to focus. I won't be able to keep working. And I need to, like we talked about, these biological needs. I need to survive. I need to keep my provider role. And that role is so important to me that I'm going to ignore the other aspects of myself. And in the moment, it makes sense. In the short term, it makes sense. The chronicity of it over a long haul, over a lifetime in a field, can be dangerous. So, that's why I've started to look at, you look at different cultures. We talked about, Buddhism. You start to look at different traditions. You look at Native Americans, how in the processes they had when they came back from battle. Things that maybe I didn't understand growing up, the chanting, the dancing, the war cry. I mean, very painful to lose a tribe member, or even the fear associated with having to go to battle. But to have some place to put it, express it, share it. And even, the way in which certain cultures have used dance or movement when they maybe were not as comfortable expressing through words.
No, yeah. So, wow, so much. So, Richard, your practice. In dealing, because we focus a lot on us guys bottling up stress and not being in the moment and not dealing openly with our emotions and all that. What do you do to help folks that may be a little different than the average shrink like me?
By different, you mean?
Well, you in the introduction, I talked about how you manage stress associated with elite performance and mental element of success, working with athletes and performances. So,
right.
This is probably something that most of us don't see is athletes and performers who reach out to someone like yourself and say, "Hey, I'm having difficulties here. How can you help me?"
Yeah, I think the first thing is, if somebody is that level of a professional that's aware that they already want to stay on top of their mental game, they're probably already ahead of the curve, right? So somebody who's seeing it for themselves. I mean, the beauty of a lot of sporting environments is you have coaches, you do have, depending on your age, if you're a younger athlete, a lot of people, teachers that are around you, and they're seeing the way in which you're managing stress, or seeing that you're, like we're talking about, maybe you're turned off a little bit, you're a little timid, you're a little shut down, or you're shut down based on one performance, one experience. So having that context of what's going on really, really helps. So the referral to me is not always coming from the person themselves, or they're getting it from a coach that's saying, "Hey, kind of come in as an observer, see what's happening in the dynamic here," because a person may act one way with one coach or with one team, and they may act very different when they're in a different set of circumstances. So the roles in which we may be asked to play are very different. And like I mentioned, high performance can be executives at some top tech companies. So if someone's coming in to see me, I mean, I think part of it is, first of all, to give them a space and to give them some tools to slow down, whether it be practicing some mindfulness in session or making sure that's part of their routines. Trying to look at the situations, which are the situations in which they are freezing up. So in which ways are they slowing down? Which ways are they noticing that their performance dips? Are they needing help with some routines that they could use before they go into a game or performance, mid-performance, or post-game to kind of help them, or post-boardroom, right, to help bring the nerves down, bring the levels of activation, which get brought up in times in stress, back to a calmer levels, and process some of that tension that comes out. That's going to come when you're constantly pushing ahead to be a higher performer, when you're challenging people more, when you're pushing the status quo, when your decisions have high impact monetarily or on other people. So there's an extension of the nervous system that is to be acknowledged. And so both identifying the goals and areas which are the athlete or performer is seeking to challenge themselves to grow and be great in, and the ways in which they can kind of reset the dial on their odometer. We're using the car metaphor, right, of letting the RPMs slow back down. What are those things that, maybe what everybody else does is not how you reset. Maybe having drinks after work is not how you feel better. It's just another area that you feel like, you're competing and doing what everybody else is doing. So, finding out the unique ways in which you reset. If it's, becoming a fly fisherman, and Phil Jackson had the lake in Montana, whatever it is that's unique to you. And that may be a discovery process and the benefits of that. So my goal, if you've been an athlete and you've been playing since you're 11 years old and now you're 32, you in some ways are just beginning to understand who you are. And in some ways, the permission, even just allowing that permission to be an explorer, to be a novice in certain areas, and not having to be the high performer in all areas of your life. So I think my role is to create an expanded sense of identity and to invite them into that space. It may be real challenging at first.
Thank you for that, because I'm a little embarrassed now. I feel like I focused it all in on athletes and performance. And keep remembering, you said doctors, you said attorneys. And it brought to mind, I had a doctor who actually was a management referral. Management referred him to me because I kind of went, oh, duh. You're speaking to that. And you're right. Looking at their uniqueness, looking at what their triggers are, what can I say? You're right on.
And the whole history, what led you and your family to become a doctor? What pressures were there on you? Sometimes the levels of performance since grade school have been failures unacceptable. And, so this drive to help others or to, be someone who takes care of others can often come at a cost. And so you'll see, it's not uncommon to get that kind of, for a substance abuse referral, when somebody is stuck on what they may do to kind of short-term trick the system to keep going, to numb the pain and things like that. So the importance of doing work like this is, well, why would I want to go in and face, my triggers and feel the uncomfortable feelings? It seems like, the why there's been a little bit of resistance and stigma, at least historically. Well, it's because, some of the things that we're doing are not working, right? The levels of health conditions related to stress, opioid addictions, things that are being used are just, the damage is being studied, and long term, there's no judgment on what people do short term to get through crisis. But long term, the damage of not working through these emotions, which are so valuable to who you are as a human being, getting through that pain, having that cry, learning to get support is essential for our humanity. And I hope we're going to get closer to that. I hope everything, in the time we're in, is pushing us closer to getting more connected, even as we're here at a distance.
Yeah. You touched on a couple of points that struck me, because I just last evening was talking to a client about alcohol use and dealing with stress. And I said, the reality is that you may take the alcohol to take the edge off, as so many people have said. Reality is the problem's still there when you're done drinking. And in the morning when you've got a hangover, now you've got a hangover on top of your problem. Welcome to reality, But the other thing that occurred to me as you've been talking too is something that I find in doing couples work is the connection of the emotions, where so many wives are saying, he won't open up with me. He won't share his feelings with me. And you hit on a very valid point there at the beginning. We're taught as men, don't do that. And then later on in our lives, we get married, and the wife is saying, no, do that, do that.
Yeah, if anyone's read, Brene Brown's work on vulnerability, really positive, because, it gets into the desperate need, even in couples where they're wanting to get help and desperately needing help, and yet the trust isn't there. Can my wife, can this individual hold the space for me? Can they really understand, or will it hurt them if I tell them what I saw, what I went through, and being deployed, so this protector mechanism overrides. It's so complicated, the identity and what happens internally, even as we begin to ask for help, even when we know we need help. And it takes, really, that's why the help of someone doing couples work who can create that container of safety, that it's okay to take that risk and make a request or practice being vulnerable one step at a time. It really is a practice.
It indeed is. It indeed. Well, thank you, Richard. This has been really good. Here in the last few minutes, is there anything you'd like to offer, or maybe you can offer some ways that people can contact you? We'll have banners and things, but if there's other things, this is your moment.
Sure, I'm happy, Ola, if anyone mentions this interview we did, to offer a 20-minute free consultation to any of your listeners. And they can reach me through Instagram, Richard Listens, Facebook, Richard Listens. I'm on, I have a Patreon page, patreon.com/Richard Listens, if you want advanced content and behind the scenes for my podcast, or if you or someone would like to be a guest. We're also doing a panel upcoming for athletes and going into transitions, whether it be quarantine or into retirement. So there'll be a 5-part panel covering things like transitions, your body, your money, your relationships. So, and we hope to bring a series of panels on different subject areas where people may be needing some help and support in. So if you have ideas, bring them to me. It's an open book and relationship. And if I can be a resource to you, we can work near and far, from Los Angeles or at a distance. Great honor being here, and keep a lookout, Ole, in 2020, 21. Richard Listens, Crossing the Threshold book will be hopefully on Amazon and sellers near you.
Excellent. Well, thank you again, Richard, for joining us at a distance, albeit. Really appreciate having you on. And for the rest of you out there, again, thank you for tuning in and watching. Stay tuned for further programs. If there's anything you would like to see us do a show on, please contact me and let me know what you'd like to see. So thank you. Take care. Stay well.
Thank you, Ole.
All right.